this thing. One very famous behavior therapist of the late 60s in England, his name is Wynne Jones. He had a patient, a woman who used to dance ballet, you know? These women who just run, raise their legs and use ballet. Now, this woman had a problem. Whenever she goes in the stage, she feels she wants to urinate. A pressure of urination. So she had this difficulty and she came to behavior therapy. What did he use to help her? He used encouragement and to relax her, and then he used the gradual approach. He cheated the woman. He has a special machine that measures the pressure in the bladder of the woman. And this machine would show the number, the pressure which she can tolerate. Then, for example, the instrument show it is 30. She says, I cannot tolerate more than 30, I have to urinate, because he pours warm water inside the bladder. Then he says to her, okay, urinate, she urinates. But then the next day, he changes the gauge in the instrument. When it reaches 30, it is actually 35. So the woman, he tells her, when it reaches 30, you can urinate. So she keeps like this, pressing herself until she reaches 30. But actually it is 35. She urinates. Okay. After a number of trials, then he increased it to 40 or 45. But actually, it looks as if it is 35 or 32. Then she urinated. So by time her bladder was able to continue without the need to urinate until it reaches 50 or 60. She did not need after that any treatment. What did he use? What did he use? He used a gradual approach and support. Do you think he's the first to do this? Do you think he's the first to do this? I will give you an example which is exactly similar, but it is different a little bit. We have a 17th century traditional therapist in Sudan. His name is I forget the name now. But anyway, the important thing is that he used the following. They brought for him a young woman who cannot open her legs. She walks like this, only 3 inches or so by 3 inches. She can't walk like other people. And her legs do not open. What did he do? He said to her parents, bring her to me after 1 month. And during this month, he made his donkey. He started his donkey. The donkey is very little. Until the donkey became what? Skin over bones. So the donkey was holding skin over bones. This is the donkey. And the donkey became very thin indeed. Almost died. So he said to them, bring the girl. When he brought the girl like this, the girl, because this is only the bone of the back of the donkey is only about 3 centimeters or 4 centimeters. So her legs, okay, went down like that. Then what happened? He started to give the donkey water and a little bit of food. So the next day she comes, she rides like this, but the donkey, his health improves gradually. And every time the donkey becomes fatter and he drinks a lot of water, then the tummy begins to increase. The legs also gradually open. Until after about a month or so, the donkey became healthy and fat, and the girl was able to walk straight. This is the same as what Wynne Jones did with the woman who could not keep her urine. It is the same. This man used a gradual approach and encouraged her. Ya Mabruka, you are a good girl, so and so. Now be patient, just keep on them, and then the dog begins to eat and drink, and are over. This is all a form of gradual treatment, based, supported by the opposite. So this is systematic desensitization. We are applying it, we know it. Wolpe was so good in using imagination for a person to imagine. This is a great invention, a great discovery, a great useful thing, because we can imagine anything. You sit down, lie down, and you imagine yourself in the beach. You imagine the sun is setting, and the breeze is coming, and the trees are moving, but you are in the clinic. This was a great discovery. By systematic desensitization, Wolpe was able to treat all 100 patients who came. All of them were cured. So now, in systematic desensitization, the doctor and his patient must sit down to make a gradual scenes. These gradual scenes are called a hierarchy, step by step by step by step. This is systematic desensitization. Tomorrow, we try to see practically, try to apply. Now, psychotherapists, when they do systematic desensitization, they only tell the person, imagine, and they have a stopwatch. Imagine for so many seconds, imagine. When he says, I imagine without anxiety, they go to the next step. I imagine without anxiety, they go to the next step. And so on, until the person is treated. But I have developed a different approach, which is written in the paper. Okay? I think we stop.
Gradual imagination, gradual scene atau hierarki imajinasi yang dipakai oleh Wolpe. Dan terapisnya menggunakan stopwatch. Kalau pasiennya bilang bisa tidak cemas, dilanjutkan ke imajinasi berikutnya gitu. Namun beliau melakukan inovasi penting terhadap teknik tadi yang itu ditulis di jurnal tersebut. Dulu beliau di-encourage oleh Victor Mayer untuk menuliskan imajinasinya itu, improvement inovasinya tersebut. Dan besok yang akan dijelaskan dan dipraktekkan adalah inovasi beliau terhadap cognitive desensitization. Systematic sensitization. 5 menit terakhir ada yang pertanyaan? 2 aja, silakan.
Sudah, Assalamualaikum warahmatullahi wabarakatuh. My name is Mubarak from Jakarta. In this book, Malik Badri did say that to cure the problem of heart must be with bil ilmi wal amal. Bil ilmi means that we must find the reason why we need to change. For example, we easily get angry or we get easily jealous to someone. Then to cure the problem, so we must bring into our mind the reason why we need to change this. And usually to this, I try to find story or hadith or ayat Al-Quran and repeat that ayat or hadith into our mind. And usually before I go to sleep, and as you said that it is good to do the relaxation. So what do you say about that? Thank you.
One more question. Quick question.
Assalamualaikum warahmatullahi wabarakatuh. Nama saya Budaya dari Yogyakarta, Indonesia. Pertanyaan pertama adalah kita membahas tentang psikoterapi. Dalam Islam itu terapi terbaik yang Allah berikan kepada kita adalah zikir. Allah berzikirlah kita tatma'innul qulub. Ya, jadi yang saya ingin tekankan adalah zikir itu akhirnya bisa ya Pak ya dijadikan sebagai self terapi untuk masing-masing kita gitu sebagai pribadi muslim ya Pak ya. Ingin mengkonfirmasi itu ke Bapak, jadi akhirnya itu untuk muslim. Akhirnya kalau untuk kita kembangkan, untuk kita aplikasikan psikoterapi di luar muslimnya itu gimana ya Pak? Gitu. Jadinya pengembangan dari psikoterapi muslim itu tadi yang bisa diterapkan secara universal untuk non muslimnya juga, misalnya kayak itu bisa nggak kita kembangin gitu dari situ. Terus pertanyaan kedua, kalau misalnya klien itu mengalami personality disorder gitu yang udah cukup berat, terus ada waham, ada delusinya segala macam, pakai imagery kayak gitu, gimana ya Pak? Bisa nggak atau itu malah makin memperparah waham delusinya kayak gitu? Kalau tadi kan sempat dibahas tentang imagery kayak gitu. Kalau untuk disorder yang udah parah sampai ada waham delusi kayak gitu, pakai imagery-nya akan jadi pendekatan yang tepat ke disorder itu atau gimana? Atau ada alternatif pendekatan yang lebih baik untuk terapi klien dengan kondisi disorder yang personality yang cukup udah berat kayak gitu? Itu aja sih. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
the young man spoke about jealousy. If you have jealousy, then you begin to say that this is not good, to have this feeling, and then to think about all the ayat, the hadith, the life of other good people, Sahaba, in terms of this. You try to make, you are using the opposite. You are using the opposite thought to fight the thought of jealousy. Now this is not behavior therapy alone. This is cognitive behavior. What you are talking about is the use of cognition, of thought, because the jealousy is a negative thought. And you try to get rid of it by its opposite. This is okay. This is, but it is not gradual. Here you are directly attacking the thought. It is not systematic desensitization as such, but it is a cognitive therapy of bad feelings that a person can have. At times, if you want to use the opposite, you may use punishment. For example, I know of a person who has some such thoughts. Not only this, but when he gets the thought, the negative thought, he begins to move his head like this, as if it is a tick, D-I-C. So I told him to bring a band, elastic band, very strong one, like the one you use to hold the money. An elastic band to wear it in his hand. And then, as soon as the thought begins to come, you pull it and let it go to lash himself. Some people may use an electric shock, but this is good because you can take the elastic band around your wrist like this. You can take it anywhere. And as soon as the thought comes, pull it like this, let it go. Jump, 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 it hits you. Painful. Then the thought will go out. This is called aversion therapy, like punishment therapy. Because at times, the negative thought can come at any time. Now this man not only got rid of his sudden silly thought, but he also stopped this movement of the head. He stopped. So there are so many ways of psychotherapy. But now I'm only concentrating on the one which is most used, which is used to be as therapists in the future. Because you can use systematic desensitization very easily and you can apply it. Yeah. The second question, you see when we talk about hallucination. Hallucination is a person to see something which is not there. A person, for example, sees a lion and the lion is attacking him. This is not psychological disorder only. This is mental disorder. He is mad, he is psychotic. A person who comes to tell you, and he is only a janitor in the university, and tells you, I am the rector of the university, or tell you, I am the head of the republic, and the president of Indonesia. And you know that he is only a janitor. He cleans the tiles and the toilets. This is his job. Then he comes to tell you, I am the president. Of course, he's out of his mind. When a person is out of his mind, There is no point in using systematic desensitization. The treatment for such people is different. We are talking about people who know who they are, who are in touch with reality, but they have a problem. They know that, for example, a person with a phobia, he knows that a cat will not bite him, but still he is afraid when he sees a cat. Rationally, he knows he is wrong, but he cannot get over it. Can you follow me? Seeing things, hearing voices, this is not the area of... but once he begins to improve, then after that, in order to be able to fit in the society again, he may need systematic desensitization and therapy to help him readjust in the environment. Yeah. Yeah. For a Muslim, you cannot make him mixing for life. He doesn't believe in Allah the way we believe in Allah. But you can help him in his own way, in his own religion or his own belief. Within his own belief, you can help him to go through that. I don't know if this is halal or haram, but I do it. A Christian who does not believe in Islam, but who has this terrible psychological disorder or symptom, I help him with his own belief. If you believe so and so, for example, someone who is a Christian and he has a problem with anger, a lot of anger, then I will bring this to him. Look here, according to your Bible, Jesus said that if a person slams you in your right cheek, give him the left cheek. You should begin to be spiritual. You should do so. They can do that. But I cannot force people to make it right. You cannot change the hearts of people.
Oke, terima kasih sekali. Insya Allah kita akan bertemu besok pagi dan mohon untuk membaca paper yang sudah dibagikan. Demikian kita tutup sesi dari Sosial ini. Sebelumnya Pak Habib ingin menyampaikan sesuatu.
I was deeply impressed with your passion. Yeah, your attentiveness. And I saw one of the participants from Unisba. Am I right? You are from Unisba? Yeah. So, why don't you come forward? Maka, apa yang I would like to give the books for the Faculty of Psychology of Unisba. Yeah, if you don't mind. Maka, yeah. This from Bandung, Yogyakarta. Some months ago, we organized a workshop for the Faculty of Medical Faculty for 2-3 times in Bandung, and then the last was, I think last year, March last year, we organized a big event for 2 days in Unisba Bandung. So, I don't know.
Well, thank you very much, Professor.